It's a pleasure being here with everyone, and appreciate you taking the time to talk with us in terms of how we can better connect clinical data into and out of the Lawson applications.
Great. Well, let's get started. I guess it's fair to have a picture of who you're talking to, and this is a picture from 12 years ago. I didn't tell you I was going to do that. Sorry, Dad. I did not do this to embarrass myself or embarrass Steve. This is Steve and I and the rest of our team at a Lawson club trip in 2000. I offer this once so you can see who's presenting, but more importantly, this is probably a symbol, if you will, of the close and growing relationship between Symphony and Infor, and Steve and I are privileged to take a leadership role in that relationship. So what are we going to do today? Let's talk about a couple of things. Everyone was kind enough to offer some answers to questions I had on the registration page, and I'm going to share that with you. I want to share with you who Symphony is and the healthcare credentials that give us the qualifications to host this today. I want to touch on the value proposition of Lawson Business Intelligence, especially in the healthcare space, and then kind of make a thesis, if you will, of this integration is moving out of the optional or nice-to-have column and finding itself quite at home in the required column. I want to show you a little bit about what we've done, and then I've asked Steve to be here to introduce and share with you a little bit of what the Lawson Clinical Bridge is, as it's a new product offering, and then the healthcare analytics, because we are on the topic of healthcare, so a number of topics there today. And then I want to offer you some perspective on some things that Symphony does in the clinical analytics area, and I'll use the term advanced and get to why I do that. And then some question and answer, and I've got some polling questions here. I've never used them on GoToMeeting, but we'll test those out to ask you for some feedback. And as Kavi mentioned, feel free to put any questions in the GoToMeeting chat box. So those of you that answer the question, here's kind of who owns what in terms of business intelligence. The vast majority of you as Lawson clients, it's not surprising that you do own Lawson Business Intelligence. And Steve and I are going to try and stay away from TLAs today, three-letter acronyms. We'll explain them as we use them. A number of folks don't have BI tools yet, and then there's a small slice of folks that either have not implemented LBI, and that's probably just because of a recent decision. In terms of what medical record systems you're using, looks like it's very quickly evolved to an Epic and Cerner world, and that's not surprising. In terms of the integration, I found this question very, very interesting. First of all, this data is based on the sum of all the attendees, and one or two of these are skewed a little bit because we have multiple attendees from one organization that is actually doing some automated. So this is a little overstated. The net of it is over half, approaching 2/3, are doing something other than no. Either you're doing it manually, and I'm presuming a lot of that is probably our old friend Excel. Two organizations out of the many that are here, the vast minority, are doing something in some automated fashion. And a lot of you are considering, which is probably why this got your attention. So thank you for sharing that information with us. In the Lawson space, many of you may have known JGI. A little over a year ago, JGI and Symphony came together to form one company. And so when you hear the name Symphony Corporation, think of the legacy of JGI in terms of being attentive to and serving and supporting the Lawson customer base. A couple of things about Symphony, and I'm not a big fan of reading to you, so I'll let you read this. The net of it is there are skills that we bring to the healthcare industry that are both broad in terms of how wide we cover, beyond just an ERP space or just a clinical space. And it's also very deep in selected areas. A couple things we do have are the certifications from CMMI, which I believe is the Center for Medicaid and Medicare Innovation, and I'm sure the level 4 part of that is meaningful. We also have an ISO certification, which is kind of nice. In terms of technology partnerships, we are a service partner to Infor. We also are a partner at Oracle, and for those of you from Infor that are on the call today, that's because there are a few remaining PeopleSoft customers that we're trying to bring in from the cold, and we're here to do that. The relationship we have with Epic, I have their logo. I don't have the other clinical logos up. We do have a relationship with ADP, particularly as it relates to benefits accounting. And then, of course, you got to have a Microsoft logo because we all have Microsoft logos, right? So that's a little bit of kind of who we are coming to this equation. Our website is Symphony Corp, not to be confused with Symphony Services, which I think has had some activity in the Lawson space. So what do we do and what have we done in this area? First of all, we have some of the traditional service practices around the admin and clinical. Admin meaning basically everything but clinical. And we do the traditional implementation, upgrade, the optimization, the reporting, and so on and so forth, primarily around Lawson in the admin side and Epic and Cerner in the clinical side. Once we had those practices side by side, it became apparent to us that we had a pretty good understanding of the totality, if you will, of the data in a healthcare organization. And that's a little bit of a unique qualifier. A lot of folks have a point of view of just the clinical or just the financial or just the HR. We have a very broad look. And what that's led us to is this space where the business intelligence experience, particularly with regard to Lawson from JGI, and the clinical expertise from Symphony, as we blended those skill sets and began to do cross-training and cross-assignments, we really ended up in a unique place about how we can help you do things from a reporting and analytical standpoint. And it turns out we have a nickname, and I'll use this, the reporting guys. It turns out one of the other folks in that photograph gave us that. I share that with you if you'll only agree to recognize that's a tip of the iceberg kind of thing. This is not all we do. We do a great deal more. One of those is we actually have a software solution we call Population Health. It's actually called Smart Care 360. It is a population health and care management system that we developed jointly with Johns Hopkins. There is a subset of that system called Smart Care BI, and I'll touch on that just to give you some perspective of what we do. In the Lawson or Infor space, and I'll go back and forth, Steve corrected me yesterday, it's Lawson now as a product name and Infor is the company name. So yes, we do all the things that all the other folks do, but we have particularly strong expertise in the LBI space. A couple of clients I believe are on, we'll see your own logo here, who we've done business, and you may know us as JGI from that period of time. A couple of things worth mentioning here. One is CMS. I think we've done a lot of work for them in the migration from one IDN standard to another. I don't know if it was 9 to 10 or 10 to 11. University of Wisconsin Health, we've done some enterprise data warehouse things above and beyond to consolidate everything they had. They had more than just admin and clinical. They had a medical school plus a student system plus a hospital plus a health plan and some other things they were doing. And so we stepped kind of above that. We've done that before. For Cleveland Clinic, there's a lot of things we've participated there, and Steve can speak to that later on. DeVita and Marshfield Clinic both have custom clinical systems as opposed to store-bought or packaged solutions, and we've been very involved in building and evolving those. In the children's space, I'm working on the alphabet. We've got Atlanta and we've got Boston, and if anybody here with the letter C, I'm probably going to give you a call. I guess Children's or Cook or would be there. So that's a little bit of the brag sheet of what we've done. Each of these clients, we've done something for them in the healthcare space, a lot of which might be either Epic or Lawson or, as we did in some other places, above and beyond that. So let's talk about LBI. I know that a majority of you have LBI, and some of this will be redundant. There are enough of you that don't, so I want to touch on that. A couple of things LBI can do that other folks can't is it's built from the ground up, if you will, and it's built by the same folks. And that's worth something, if you will. A couple of things here. Again, I'm not going to read them, but if you glance through these, they sum up to a faster and quicker time to value, and you have a single phone number to call in terms of who owns that. And LBI meaning Lawson Business Intelligence. I promised we would do the acronyms. So what is LBI made up of? There's 5 major key components, and we'll touch on these. The framework that builds it all out, reporting services, which I'm very curious how many people are using that. Smart notifications is another big part, and BPW we'll get to in the process flow. Some ways these will fit into a context. If you were to build out a dashboard, and this doesn't look real different than some of the original things we saw back in the day when Yahoo first came to build a web portal. Remember, myyahoo.com was kind of a big deal. Where you end up with some indicators, a summarization of all the reports that are available to me, some alerts and reminders, and then maybe some external. Because remember, back in the day of the Yahoo portal, everybody had their stock prices and weather and that kind of thing. Well, LBI can support this metaphor, if you will, or this means of communicating data. For example, in the KPIs and graphics area, KPI meaning key performance indicators, Viewpoint can push some things, and I'm going to show you some examples in a minute. You can also have smart notifications push information here or here along with the process flow. So smart notes and the process flow can help here. The reporting area can come from multiple places. One, you can use Lawson reporting services. Another can be something like Lawson's report writer that goes into the reporting area. Also, Crystal Reports can fit in there, and that obviously can be sourced from anywhere. And a lot of people are putting reports written from their clinical system side by side with reports from their admin system, and that's a way to do that. And then any sort of external information such as news alerts or whatever. So this metaphor that we were introduced to 20 or so years ago continues. We're just now putting business information in it. So reporting services, a couple of things that happen here. Excuse me. This is the report bursting, where I run a report once and distribute it many times, where I use a filter made up from the role-based security that says while I run it and use the CPU once, I distribute it based on who has what authority to see. And some ideas where you'll get, managers getting data about only the people that report to them. And then you only get information that you're not only entitled to, but you don't distract people with other stuff. One of the interesting things we're seeing people look at and talk about is, why don't we use this reporting services functionality from Lawson with our clinical data? Because you can easily share security roles and use this to distribute clinical information, especially when you begin to combine it. So that's one thought I'd like you to leave today with. Another is the use of smart notifications, and this is the idea where the system looks at a predetermined condition in real time, notices that that condition has been met, and tells you about it. The nickname I used to give this a long time ago was "System Protect Me from Myself." This is where I don't have to go look up information and look for problems. The system will tell me that problems are there, or that the early warning signs that I have in mind are there. A couple of things are some great examples. You can use a traditional stock or staffing metaphor. One of the things that we've had some conversations with folks at would be from the perspective of a risk manager. As you begin to homogenize and consolidate the data from the clinical world and the admin world, you can look at HR data in terms of credentials and look at procedures and staffing and scheduling, and the risk manager might have a smart notification where someone is scheduled for a procedure coming up that doesn't have the right credentials, or the credentials are out of date. And that's obviously information that you don't want out if it should happen, but it does present an item of risk. Steve, I think you had mentioned a scenario or two that you were aware of people were looking at.
Yeah, absolutely. Smart notifications for the customers who have the Lawson Business Intelligence solution. If you haven't taken advantage of this functionality, it's one of the most exciting pieces, because it allows you to reach out and touch someone when they maybe haven't logged into the system already. And some of the creative ways that we've seen our customers use this, one in particular relates to really controlling labor spend. We have an organization who actually overnight will look at their census and acuity using smart notifications with the Lawson Business Intelligence application, look at the amount of staffing that's needed, and use that to send at 3 a.m. An updated request to their nurse agency partner to make sure that they're bringing in the nurses that they need with the qualifications, but they aren't bringing in extra nursing care at the last minute, which is very, very expensive, which obviously has an impact on the cost of care. So not only are they leveraging this tool with Lawson information and Infor data, they're leveraging it with clinical information, and they're even sharing it with an outside party. So it's really one of the high forms of the art, where they're leveraging the technology not just to make the day-in, day-out Lawson users more effective, but the entire process and continuum of care.
not bad. You can use a tool you've already bought for other reasons and get orders of magnitude of additional value and impact out of it without having to invest in yet another solution. Thanks, Steve. Let's talk about a couple things in the healthcare space. Accountable care is kind of a big deal. And let me just, and I'm not presuming that everybody's going to become an ACO, but it is a relatively important part of our present dialogue. Accountable care, a couple things you'll see here: cost-effective, financial incentive, risks, and gains. Basically what an ACO does is tries to transfer some of the risk and the gain or loss away from the payer to the provider is what's going on there. And so say what you will about the future of this, a lot of the conversation will continue to focus on the elephant in the room, and that's costs on the present track are going to be a real serious problem going forward. So I think what's going to happen is people may not become an ACO, but they're going to begin to adopt elements of this. That is, let's look at more cost-effective ways to share care and that kind of thing. So what does this mean? Again, back to Steve's point, on a timely basis, a more complete view of the totality of information, especially with regard to patient. You're going to see more workflows around protocol, adherence, and the avoidable errors are going to be things you want to reduce with more workflows. You're going to see the emergence of additional tools, and this is an area we know a lot about in terms of the productivity of the clinician and looking at the efficiency of the overall operations. We're seeing tools, and again, we know a lot about this from our Smart Care 360 and our interaction with Hopkins and the other users of that. The caregiver and patient relationship and the interaction, we want to make it more impactful. We want to put tools in front of the caregiver and the case manager that knows the totality of what's going on with that patient, so that you don't have to ask the same question to 3 or 4 people to get an answer. So you're going to see more tools emerge in that space. You're going to see a lot of analytics that says, I want to understand day to day what resources are best applied where in terms of where that resource can create the most benefit. A little controversial at times in terms of how you do that, but the point is the tools will continue to evolve in that space. Care model, you're going to go away from time to time, more movement away from the fee-based and more to the shared risk model. And this continued focus on detailed cost control. It's one thing to know the costs at a departmental level, but it's very revealing to know that at a detail level in terms of at the procedure, that kind of thing. So if I say that differently, there's plenty of change, expect it, embrace it, and frankly, that's one of the reasons that I'm attracted to the healthcare space. So putting this data together is an interesting element. The data that your executives are looking at to run the business comes not only from admin, but a lot of it comes from clinical systems, because you're looking for risk, you're looking for outcomes, you're looking for how are we doing running the business of serving our customer base, the patients. The admin alone will not do it. And so I think you're going to see the reports to manage cost and quality as an ACO, more importantly, or if you're adopting elements of that ACO methodology, which we're seeing people begin to do. Not everybody wants to become an ACO, an accountable care organization. But the idea of a single point of access, one place to go for all things for my organization. I know a lot of folks, when I looked at that first chart of how are you doing integration, some of you said manually, and I suspect that's very timely. In fact, if anybody that did answer that question is doing that on a timely basis, I would welcome some of your feedback in the chat window of how much time you think it takes to prepare that on whatever regular basis. Is that something you have people doing daily? Is that something you have people doing weekly? And how many man hours or man days does that take? That would be some good perspective to share with everybody else that's here. We're using these tools to take an integrated approach. So let's think about this. We've got the clinical scope, the administrative focus and scope. Putting those together is one level, and then we put them together in a business intelligence metaphor. And so this is the way we're going about combining the data. So there's a couple of ways to do this. I use the crawl, walk, and run metaphor. Crawl, I mentioned in that dashboard, where you could consolidate reports from separate systems and publish them on a single platform. Remember that upper right-hand corner where you had the reports, and I mentioned Crystal. A lot of people are doing that, where I'll get Crystal-based reports from other solutions like an Epic or Cerner or McKesson, whatever. But the Lawson desktop is where I'll make that available for folks to see. Another one is, let's combine the data sources in a single platform and publish the reports and metrics. And the third one, I mentioned the University of Wisconsin situation where we had kind of gone above and beyond and created an integrated data warehouse. So there's 3 metaphors here on how you're doing that. I'm going to try a poll question and see if this works. I've got a question where, of these, I would welcome your feedback to understand which of these metaphors either is presently at work in your organization, or if it's not, then what would your vision be of a scenario that would be embraced and supported by either your technical footprint or your culture? So I would welcome that. Okay, it looks like 35 to 40% say crawl, 25 to 28% say walk, and 8% say run, and 23% say more than one. Okay, interesting. I'm going to leave that poll question open for another 30 seconds, and then we'll save that. Thank you for that feedback. I appreciate that. Interesting. This poll thing is kind of cool. Thank you all for responding to that. Okay. A comment or two on, it sounds easy as I've kind of described it. The reality is it's not. In the ERP world, if you think about transitioning from one system to another, the world has been pretty straightforward because we have generally accepted accounting principles. We all know what a W-2 is. We all know what a 1099 is. And so there's been this legacy of standards, if you will. When you get over into the patient data, you've got all this fascinating variety of types of data, and it's been paper-based for a long time, which means over time it's been difficult to put different organizations' styles side by side. And so the comment here is just, it's not been easy, and the equivalent of generally accepted accounting principles and 1099s and so forth doesn't exist necessarily, or if it does, it's very, very early in its maturity, if you will. So this is not that easy. In the meantime, before Clinical Bridges come out, here's kind of what we've done to address those folks that have decided to take an automated approach. We integrate Lawson data and Epic data. We use the Business Performance Warehouse as the data engine, which is part of LBI. We use the ETL, which is an extract, transform, and load tool. And then we deliver KPIs through Viewpoint, again, another part, and we use Smart Office. How do we do that? Well, kind of back to the points I made early on, it requires you've got to know both Lawson, in this case, Epic. Now, if you're not a user of Epic and you use Cerner, Meditech, and GE, Siemens, whatever, substitute your system here because the details of the data are different only in how they're organized and how they're identified. You're going to have patient data, you're going to have clinical data. It's just going to be organized a little different. We're comfortable doing that. I just happen to have this as a legitimate example. And you get a pretty robust solution. So let's walk through what this looks like. So what I did was, again, it's a model-driven tool. We use ETL. You can bring in reporting against the Lawson data and, in this case, clinical data. And there are multiple dimensions here. The Viewpoint, which is the presentation engine, helps you create personalized reports, and I'm going to show you some examples. This is a snapshot, and again, I'm not going to live code because when I do it in PowerPoint, it works the same way every time. I understand, and for those of you from Infor, I know this is a little older version of the way this thing looks in its present incarnation. Take that as a reminder that we've been doing this for a while in the Lawson space. So I'm going to open up Smart Office. I'm bringing up the Viewpoint runtime, and I'm going to go to the role of CFO. And so I'll say look at net income, which is where I'm going to look at revenue, and this is data out of Lawson. And so I'm reminded that I'm looking at revenue. I can do a drill down and get to a deeper level here. So you get nice standard reporting delivered right out of LBI. Now, I'm going to go to the same place, and I have data from Epic in this case. The data element I have is patient days. Same metaphor, I'm at patient days, and I'm using some of the traditional mechanisms. So I'm looking at revenue, patient days. How many patient days did I have in each month? Over here, I'm looking at different locations. I can use a checkbox, and I can take some checks out of that to reduce what I'm looking at. So now I'm able to compare patient days for 2 locations without having to leave this application and go somewhere else. Now, let's do a little math here. Revenue divided by patient day. That's a key metric, and it's derived a division or a math exercise of the 2 sources. So I've got revenue per patient day, and I'm looking at all 4 of the locations. And now it gets interesting. I can do the same thing here, uncheck a couple boxes, and so now I've got 2 locations. I'm comparing revenue per patient day, and that's a very clear indication of the performance difference in those 2 locations. And so all we've done is take the data, bring it into business performance warehouse. I keep wanting to say process warehouse, performance warehouse, and present it in SmartPoint. So which of these 3 did we do? Let's, oh, I don't have a poll for that. That was the walk, right? I'm combining the data sources in a single platform. So I'm not suggesting you need to go out and build an integrated data warehouse. There are circumstances that justify that, but this is not one of them. Using, in the case of most of you that already own LBI, this is something that you can do with a little help. Now, some of that help is going to come from Infor, and as they've begun to evolve their product line. Let me let Steve introduce you to the healthcare analytics from Infor as well as the clinical bridge.
Sure. Thanks, Mike. I appreciate you sharing that, and some great examples in terms of what Symphony has done to connect and break down the silos between the operational systems as well as the clinical systems. To Mike's point in what it is that we're looking to accomplish with our partners and for our healthcare customers is not only do we want to provide the platform for you to run your business on, we need to do more than that to really shift to the new value-based accountable care organizations and healthcare reform in the United States, and of course just the global pressure on healthcare worldwide. So to help with that, one of the things that we worked on internally was a project that was internally referred to as controllable spend management. More specifically, looking to identify all of the pieces of the Lawson Infor universe of information that we had access to and our knowledge of the clinical information to provide key data elements that are founded in the Lawson Infor applications that you use today that allow you to drive to controlling and reducing spend in each of the 3 areas of labor, human resources, the supply chain and purchasing, as well as the overall financial management and efficiency of the organization. And the approach that we've taken is we're using exactly the same tools that Mike had just described, the Business Performance Warehouse, the Lawson Business Intelligence, including Viewpoint for Lawson Business Intelligence, to deliver this pre-delivered content. So the value being, instead of this being something that you need to write your own reports for or build related to each upgrade, this is content that the Infor Healthcare team delivers. It works hand in glove with the Lawson Business Intelligence application, which would accomplish that walk scenario that was just described, bringing together a variety of different information. And we've included in these data models that you see here placeholders for the clinical data that we know needs to be part of the information that informs financial information or labor and staffing. So just something as simple as a staffing to wait time. We're looking at the relationship of how long is a patient waiting in your waiting room, maybe it's in the ED or a particular specialty, and the staffing levels that we have visibility to, either in our solution or we could even be drawing this in from a third-party component such as Kronos or API to give you a combination of information that was previously incomplete, or if you were to get to it, you'd have to log into 2 to 3 different systems, much like the data that Mike was just showing related to revenue per patient day and the combination of sources that would make that seemingly simple calculation actually very hard to get to. So with the analytics for healthcare, We've pre-built. We now have over 300 indicators that we deliver in each of these different areas of finance, supply chain, and labor to be able to get you to walk, but it also supports the run model as well. So the information that we're producing here can obviously be used by a Lawson user day in, day out, and can also feed into an integrated data warehouse supporting a broader initiative where you are bringing together large population health data side by side with financial performance, the staffing, human resources, all of the purchasing and the specific items that are used with an effort to get that lower level of granularity of what is my cost per case, and am I doing the things that I know will ensure the positive outcomes for my patients.
Thank you, Steve. A comment on that word I put up there, starter kit. That's, in this case, going to probably get you to 90 or 95% of what most CFOs want. That's a reminder for me to point out that I'm a CPA and I've been in this business 20, 30 years. I have yet to meet a CFO, in spite of how good a job we do as a vendor and service partner, that didn't want to tweak it a little bit. And the good news is that there's help available from Lawson or from Infor, excuse me, to help with that, or from Symphony, because we understand and have been doing this as long as, maybe even longer for all I know, as anybody's doing that. So this is a terrific offering, and we're excited about this because this gets us out of the doing this by hand over and over again for the customers, and lets us get into a higher value of what we can do to assist. So we're very excited about this.
As are we. This represents several years' worth of development engineering effort internally for the Infor Lawson team. So it's time, to your point, Mike, of this being a starter kit where you can consume all of this content. We'll support it from release to release. Our partners are enabled to help you both get the starter kit up and running and then extend it to turn it into a source of competitive advantage. The Cleveland Clinic is one of our customers. They specifically use the healthcare supply chain analytics, and they're really doing that combination of the walk and the run that we were talking about earlier, where they're serving information into the Lawson Business Intelligence platform, but also are using the same analytics for healthcare to fit into their enterprise data warehouse.
Speaking of getting data into the data warehouse, I'm going to let you take the slide here and talk about the Clinical Bridge, because it's something we're, again, especially excited about, because we'd rather be in the business of helping implement a standard offering supported by the vendor than writing custom things. So, Steve, tell us about Clinical Bridge.
Sure. There's really two ends against the middle is our strategy here. So we were just talking about how to bring information together in a way to make decision making. That may be coming from multiple sources, maybe it comes from a single data warehouse, but the idea that we need to break down the silos for the people who we've trusted to make decisions, giving them the information that they need at that point of decision making. The other end to the equation is how do we make the transactions, the day-to-day activities that need to occur, more efficient between the operations as well as the clinical sides of the house. And we and our partners like Symphony have been building for our customers on a custom project basis a number of points of connection between the Lawson applications and key clinical systems such as Epic and Cerner, using technology such as the Infor Clinical Bridge, or I'm sorry, the Infor Cloverleaf integration platform that in many cases does all of the clinical integration inside of an organization's enterprise. So what we decided to do is, because we had done a number of projects and our partners have helped a number of different customers in healthcare build similar sorts of connections, we've actually created a standard packaged offering. Much like the Analytics for Healthcare is delivered content, the Clinical Bridge is delivered content for integrating your Infor Lawson applications specifically to other clinical systems in a way that allows us to essentially speak the native language of the clinical environment, so you can leverage your overall investment in a clinical integration engine such as Cloverleaf. And what we've done is we've really keyed in on three areas in particular. We're not simply looking to create points of connection for the sake of creating points of connection. There's a Bermuda Triangle that Mike had alluded to, which is we don't know really how much each individual patient has consumed in terms of labor and supplies and other resources. We have a sense for what things cost, but it's in general and it's typically allocated. We don't know directly. And lastly, revenue. And with those three ingredients, it allows us to, at either episode of care, at a patient level, at a service line, really look at the organization and understand where we're profitable, as well as have positive patient outcomes, or perhaps where we're in the red, in particular in the era of reform where payments are already dropping and obviously plan to continue dropping here through 2021. So the clinical bridge is an appliance that connects to your Lawson applications that allows you to speak to whatever your clinical integration environment is to accomplish a couple of things very specifically. For our Lawson supply chain customers, one of the connections that we've created is an item load, so treating your Lawson system as the item master, including CDM information and the latest cost information that we can then load into clinical systems, Epic being one, as well as point-of-use systems like Omnicell cabinets, Pyxis cabinets, and the like. So you maintain your item master source of truth, but now have a clear way of making sure that all of the clinical systems that need pieces of that item master have the latest and greatest information. We also deliver a connection that keeps the two systems up to date. So as information is updated in Lawson, those updates will be transferred to the correct clinical system. The downstream impacts are very significant in terms of having much more accurate cost information, as well as we're adding data elements such as the global trade identification number, which makes barcode scanning in the OR and many of the other areas in the clinical environment much, much easier. So we're providing information out. We're also taking information back in. We have a number of connections associated with the replenishment and utilization of supplies. So today, a nurse may log into their clinical system, and if they have to go order items, they'll log into their requisition center and put in that order. Why not have Epic just talk to Lawson and place that order on that person's behalf? And we now have that capability with the clinical bridge, much like many of our customers had created as a custom connection in their implementations. So what we've done is we're bringing back a process that is a closed loop with all the clinical systems, and we're doing it in a way that's intended to distract clinicians less and make the overall process more efficient so that those individuals have more time to focus on patients. Side by side with making sure that all of the processes, all the procedures, and all the updates that are needed to have clear clinical documentation are followed. We've also created a number of connections around the point of use. So Infor has a Lawson point of use application that would allow you in a general nurse care area, interventional radiology, or the cath lab to be able to attribute supplies used for a specific case. And in this scenario, we need to know who's in the hospital, so we take in an ADT feed. We also need to know who's scheduled in that particular unit, maybe in the cath lab, or what the case schedule is for that particular department. So we can bring either of those scheduling feeds in. And then, of course, there's a revenue aspect to this where appropriate, when those items are attributed, especially the low volume, high dollar amount items like you see in cath, those get actually passed back to your billing environment. So it's a closed loop again where we're getting pixel perfect information about what each patient is consuming in those particular areas. That information is invaluable for downstream comparative effectiveness research as well as value analysis. And we're also making sure that we're capturing and maximizing the overall revenue for supply charges coming out. We've seen increases of 30 to 40% within just a couple of months of charges that were just lost in the manual process. The point of use solution that we offer, in addition to making sure that it's tightly integrated with your clinical systems in a near real-time way, allows Lawson and an Epic, for instance, to work together as if it was one platform. And there is a saying, actually Mike Shanley I think may have started it, he mentioned that he was a CPA, that all roads lead back to the general ledger. So we have also incorporated into the clinical bridge a number of financial connections. So we're also automating the process of bringing patient revenue in at a low level of details for you to have visibility in the financial system. And then we're also bringing in patient refunds. Our financial systems are actually the systems that cut those checks that go back out to patients at the end of the revenue cycle. And we go one step farther, which is to return that check information to the clinical environment, because they don't call Lawson accounts payable to find out what the status of their refund is. A patient will call your central customer service, which will be related to your billing system. So we want that Infor Lawson data back in the clinical system so that that clinician can answer that person's question. We don't want to force them to turn around and log into our application. We'd actually prefer that they're able to do it in the native solution that they work in and day out. And because it's all of this content is a delivered solution, as you go from the 9.01 release to our 10.0 release, you'd get the updated version of those maps. And I'm happy to say with Epic in particular, I've been asked to essentially be the ambassador from Infor for Epic, and we do meet with our development organization and share roadmaps to make sure that not only can we support the Infor side of the equation, but for our shared Infor and Epic customers, that we also have the ability to deliver updates related to changes in the Epic platform, which we've been able to provide, and are in those same discussions with other major clinical system providers such as Cerner.
I've always thought of you as an ambassador, Steve. We did have some sayings back in the day. Another one we came up with, now that you remind me of some of those, was, how many folks here use drill around, right? We discovered that there ought to be a trademark in Canada. We were going to call it DrillABoot. So that's one thing we learned over the day. Thank you, Steve. A great selective area there. Let me ask you another poll question. I meant to ask this one earlier, but this will kind of bring us back to the focus. What kind of grade would you give yourself on your use of business intelligence inside of your organization? I'm going to go A or B or C, or if you need to give yourself some other grade, that's okay. Or for those of you that don't have it, we can let you participate here. So let's let this open up for just a minute. I'm always curious what sort of self-assessment you would do. And this also kind of comes back to that slide we had early on where a number of folks have a BI solution of some sort, most of you LBI obviously, but some of them have not implemented it yet. So those of you that choose to, oh, this is interesting. I'm kind of nervous now about sharing this with you. Nobody has given themselves an A, 13% have given themselves a B, 50%, well, somebody's given them the B. Okay, we're on average 20% B, 50% C, and 30% not using a BI solution. That's fascinating. Okay, I'll leave that up for another 10 seconds or so for those of you that may want to change your grade. Thank you for sharing that. I appreciate that very much. That's interesting information.
Mike, if I could add a comment on that. That same phenomenon that I think we're seeing here in this poll question, which is we have a very powerful set of tools with the Lawson Business Intelligence application, is part of what drove us to the analytics for healthcare, which was, can you deliver to us that content that would make us that A player? And that was certainly one of our objectives with delivering that content in addition to the powerful business intelligence tools that we have.
It's interesting you mentioned that. I had two more poll questions I was going to save for later, but let's go ahead and do it now. One is just a yes or no. Have we piqued your interest in the healthcare analytics? Kind of yes or no. And this is good feedback for Steve and I as we take this presentation and make it better. Let's see if I launch that.
And I'll note for everyone that this is Steve Fanning. I am not allowed to answer.
That's true. That's true. What's the old small print? Those of us that work for the institution are ineligible for the prizes and so forth. Interesting. Okay, Steve, we're getting some good feedback. About 3/4 of the folks are saying yes, so kudos to you for a nice, thorough explanation of that. And to be fair, I should probably ask the same question about Clinical Bridge. Let's give this another 10, 15 seconds for those of you that want to answer, and I'll answer the same question. Okay. Thank you all for the feedback. I appreciate that very much. Let's do this other one. I'm intrigued with these polls. Can you tell? I've seen a friend of mine make good use of that. So here's the question on Clinical Bridge. Did we get your attention on that? So Steve, no pressure. We're actually being able to get a little real-time feedback on how well we're doing. Steve, nobody has said no. Wow, thank you. Appreciate that. I'm going to leave this up for another second, and then we're going to head to the wrap-up part of this. One of the things that we do at Symphony, this may be applicable to those of you who chose not to give yourself an A. Let me go ahead and close this poll question. Thank you all for doing that. Is a visioning process where we sit down and basically look at the totality of your requirements within the scope we agreed to. We look at the tools you have and or related tools. In this case, we might look at Lawson's Healthcare Analytics. We might look at Clinical Bridge. And we come out of that with and also an assessment of the skills you have and the capability and the wherewithal to make changes, and come up with one or, in some cases, multiple proposals to do that. This is a 2 or 3 day process. It's not very expensive, and this can give you a nice roadmap to go forward. And as I mentioned, I think we're uniquely positioned to help do that. So a little perspective. I want to walk you through just some of the other things that Symphony does to give you a kind of a look at the gravitas, if you will, that we bring to the Infor relationship, specifically in healthcare. I highlighted Cloverleaf, which is one of our integration tools experience, and Steve mentioned that that's the tool set that is the big part of Lawson Clinical Bridge. A number of things we do here. We use the care groups in Hopkins in the predictive modeling. We do some grant work, and I mentioned earlier some of our population health management. I'm going to mention Smart Care from our sister company, Symphony Care Solutions, not so much as to pique your interest on the solution, but the point is we've built a big data solution that pushes lots and lots of data around from the large institutions, and that expertise of doing that is available to help you get to where you want to go in terms of what data to bring into LBI, how you want to bring it in there, and then what do you want to do with it. A couple screenshots here out of our 360 solution. We're very good at understanding the clinical data, presenting it, and helping you do some predictive kinds of things, because that's an area where we want to go in the future, especially if you look at some of those protocol-based, evidence-based guidelines and all those things that you're trying to do from the accountable care model to help you look at how do we get to cost. Like Steve and I both talked about getting to the more granular layer of cost. Well, what do you do with that in terms of the granular layer of what the diagnoses are and the application of, I guess it's the highest and best use of what resources we have to apply to what diagnoses that we have. This is one that's kind of interesting out of the Smart Care solution, where we can actually begin to get predictive not only with the likelihood of hospitalization, the likelihood of care kinds of stuff. This patient had what utilization, and then we can begin to predict cost ranges going forward. And this will only get better as we go from allocated costs to actual costs. So there's a number of good things all going on together here. This is interesting. We look at the population where we're looking at, if I have hypertension, I'm also likely to have other issues. So again, the clinician tools are all there. So I mentioned that not to get you excited about other things we do, other than the things we do. So a couple things we can take away from this. One is Symphony, we kind of get healthcare. I mean, it's what we've been doing for 15 years. We have expertise in both the admin side and the clinical side of solutions. We get big data, if you will, because that's what we do in the smart care space. We're very good at the integration. I think you've seen evidence that we're also pretty talented on the reporting side. We talked about the crawl, walk, run. There's multiple approaches, and sometimes you need to do those at the same time. And thank you for the folks that have given us some feedback on that. We do have a visioning process. It's a disciplined approach to go through and ask and get answered all the right questions to help you assess what a good go-forward strategy is. And we bring to that visioning process a great deal of expertise. I think we've talked a little bit about some of the drivers that are moving this integration out of an optional column into a required column as the accountability and the shared risk and shared gains business methodologies begin to reside, if you will, inside the healthcare organizations. We're seeing that. Clinical Bridge, healthcare analytics, as Steve very nicely described, they're ready to go, and we're ready to help you implement them because we've got the expertise on the tools that went into those, as well as we've been doing it manually. And so we're happy to get out of the doing it by hand, if you will, and into the packaged solution space there. The advanced clinical expertise, I showed you that mainly for the point that you walk away from this knowing that we do this differently. As a business partner to Infor, we've got this enormous gravitas. I didn't mention the example that I was going to in terms of if you think about an accounts receivable situation, and I'm speaking first of not of a patient AR. That's a very specific way to do that. But think back to when you first learned accounting and learned about the business. If you're looking for somebody to help you in accounts receivable, there's one person that says, hey, I know how to run the application. I can apply cash and I can run the reports. Another person would know the whole business process of sales, the write-offs, the inventory issues, the cash application, the journal entries, the allowance for bad debts, all that kind of stuff. If you had your choice between two people with those two different sets of skills, all other things being equal, it's very likely you'd pick the person that has that deeper expertise because they can help you run the business as well as run the application. And I would submit that Symphony is in a position within healthcare not only to help you run the application, because we're clearly very capable of doing that, but we can also help you with the issues around run the business. Some of you may have seen a invitation to a webinar we do on Fridays for about 15 minutes, tip of the week. That's us. We're the reporting guys, but again, that's just the tip of the iceberg. So with that, I'm happy to entertain any questions for me or for Steve. My name is Mike Shanley. As I mentioned, I'm a CPA, and for those of you that don't know, that means copy, paste, and attach. We have an email set up if you're curious about anything. We have info, but I also have Infor at symphonycorp.com. So if you can't remember my name and whether to put C's or D's or whatever, you can always remember Infor at symphonycorp.com. So at this point, I'd like to thank everyone for attending. Thank you for participation in the poll questions. Are there any questions that anybody has that Steve or I could answer for you? Okay, we are right about to the top of the hour. We are at 55 minutes like I promised. Kavi, I don't see any questions. Steve, thank you very much. It's been a pleasure to work with you again, and I look forward to the next levels of the Symphony and Infor partnership growing and what we can do for those of you who are Infor or Lawson clients, whichever one you choose. Thank you all for attending. It's been great to have you with us today. This concludes this webinar, and thank you all.